Members, we are back in session. Members, please come to the floor. Business before this House will continue. Mr. Holden, you are recognized for your motions.
Thank you, Mr. Speaker. I request unanimous consent to suspend Assembly Rule 63 and allow the following bills to be taken up today without reference to file for purposes of third reading. The bills are File Item 1, Senate Bill 637, Allen by Dodd. File Item 2, Senate Bill 27, Hill by Eduardo Garcia. File Item 3, Senate Bill 4, Lara by Bonta. File Item 5, Senate Bill 350, De Leon by Atkins.
Without objection, that request is granted. Members, we are going to take up file item number 1. Members, file item number 1 is SB 637. Clerk will read.
Senate Bill 637 by Senator Allen, an act relating to dredging.
Mr. Dodd, you may open on the bill.
Thank you, Mr. Speaker and members. SB 637 by Senator Allen. I'm presenting today. In January, a court determined that the California's regulatory program for suction dredge mining violated federal law because the Department of Fish and Wildlife could not lift the moratorium that had been in place since 2009 and issue permits to miners. The department stated they could not issue permits because it did not have the authority to regulate the potential impacts to water quality that had been identified by the State Water Resources Control Board. Therefore, the court said our program was confusing and a de facto ban. SB 637 seeks to address this problem by empowering the State Board to use its regulatory power under the Federal Clean Water Act to address the water quality impacts. This bill will give the department a path to issue permits while protecting water quality, the state's fish and wildlife resources, and public health. This bill is supported by leading environmental groups, several tribes, and the Indian Gaming Association, the Pacific Coast Federation of Fly Fishing Associations, and water agencies including the Metropolitan Water District and East Bay Mud. Thank you. I ask for your aye vote.
Thank you, Mr. Dodd. Mr. Bigelow, you are recognized.
Thank you, Mr. Speaker and members. Today I rise in strong opposition to SB 637. Members, this bill is an attempt to go around the legal process and allow the state to effectively kill off an entire recreational activity that contributes to the economy of my district as well as many of members of your communities. California's current freeze on issuing dredging and mining permits conflicts with federal mining rights and is currently being challenged in court. We should wait to see the results of these suits before we pass a law that puts even more restrictions on suction dredge mining. What is worse, there is little evidence that recreational dredging has a negative impact on water quality. This bill would damage the economy of small rural communities that benefit from recreational dredging. The state should not restrict access to the public lands or tell Californians what they can do there without conclusive evidence that is destructive. Members, people from all over California and beyond come to my district to participate in recreational dredging. I ask that you think of the people, the economy, the lifestyle of rural California as you cast your vote today. I will tell you, suction dredging is a huge value to our streams and to our communities. Folks, it's a good family recreational activity, and it's also part of our history in the state, mining. I strongly urge you to vote no on this bill today. Thank you.
Thank you, Mr. Bigelow. Ms. Gaines. you are recognized.
Thank you, Mr. Speaker and members. I rise today in strong opposition to SB 637. SB 637 will likely establish a de facto ban on suction dredge mining. Currently, the Department of Fish and Wildlife has put into effect a moratorium on permits for suction dredge mining, which conflicts with federal mining rights. By requiring miners to obtain federal and state water quality permits, in addition to any permit required by Department of Fish and Wildlife, could decimate any and all future recreational and small commercial dredge mining operations. These miners are not giant conglomerates who are polluting rivers. They are small-scale miners who are trying to make a living and feed their families. The supporters of this bill argue that these miners are responsible for polluting our rivers, reservoirs, and the Delta. A 2005 Water Resources Control Board's own study revealed that a typical suction dredge set up to recover gold recovered 98% of the mercury. Why would we as a legislature want to get in the way of ridding our drinking water of mercury and other heavy metals? Why aren't we thanking them for cleaning up our riverbeds? If this moratorium would be lifted tomorrow, based on the number of permits occurring before the moratorium was in place, this state would see anywhere from 3,000 to 4,000 permitted volunteers removing mercury from our state's waterways. These miners stimulate our rural gold country economies and is part of my district's history in this state. Before you cast your vote today on this bill, I'd like to extend an invitation for you to visit people like Flat-Nosed Bob, who sits at the edge of the river and uses suction dredge mining to mine for gold so he can pay for his dental work, to people like my dad at Sierra County, who was the dentist of Sierra County. Please remember these miners that make their living along the river like the North Fork of the Yuba and allow them to continue to mine gold and feed their families. I urge a no vote.
Thank you, Ms. Gaines. Mr. Levine, you are recognized.
Thank you, Mr. Speaker and members. I rise in support of SB 637. We had a very thorough debate in the Water, Parks, and Wildlife Committee, particularly focused on the question of whether or not suction dredge mining was a benefit or detriment to water quality, not whether or not suction dredge mining was a lifestyle, as my colleague from O'Neill's had referred to it. While the evidence is very heavily weighted to suggest that there is little doubt as to the negative environmental impacts, this bill appropriately leaves that decision and that question to the scientists at the Water Board. They are tasked with enforcing the Federal Clean Water Act. Under this bill, they will decide if this lifestyle choice of suction dredge mining is appropriate and how the water quality's impact on suction dredge mining should be regulated. Lastly, I want to point out that before our hearing, the author convened a stakeholder meeting to ensure that all the issues were out on the table to identify which could be addressed. This was following several other meetings with the opponents of the measure. SB 637 was then amended at the miners' request to spell out a very detailed public process and to clarify the definition of suction dredge mining. The author's efforts have made this a much better and more thoughtful bill, and for these reasons, I respectfully request an aye vote.
Thank you, Mr. Levine. All debate having ceased on the item, Mr. Dodd, you may close.
Thank you, Mr. Chairman and members. I'd like to thank my colleague from San Rafael for his cogent remarks, and I respectfully ask for your aye vote.
Thank you, Mr. Dodd. Seeing no further discussion, the clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 44, noes 24. Measure passes. Members, we're at file item number 2. Without reference to file, this is Senate Bill 27. The clerk will read.
Senate Bill 27 by Senator Hill, an act relating to livestock.
Mr. Eduardo Garcia, you may open.
Mr. Speaker and members, Senate Bill 27 by Senator Hill is an LL Cool J bill that establishes its first in the nation regulations for antibiotics used in livestock to help curb the growth of antibiotic resistance bacteria, which we all know is a public health epidemic that kills 23,000 Americans each year. Senate Bill 27 takes a comprehensive approach to the issue. Amendments in the last few days have been taken that has removed opposition from many of the organizations such as Natural Resources Defense Council and Center for Food and Safety and many others. Members, Senator Hill needs love. I need love. I'm respectfully asking for you to support this bill. Without your support, Mama said knock you out. I respectfully ask for your aye vote.
Thank you, Mr. Garcia. Seeing no further discussion on the item, the clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote who desire to vote. The clerk will close the roll. Tally the vote. Ayes 54, noes 7. Measure passes. Members, we are at file item number 5 without reference. Pardon me, members. This is file item number 3, SB4. Without reference to file, clerk will read.
Senate Bill 4 by Senator Lara and others, an act relating to health care coverage.
Mr. Bonta, you may open. Members, please give your attention to Mr. Bonta. You may open.
Thank you, Mr. Speaker. Members, SB4 builds upon our recent budget action to provide Medi-Cal coverage for 170,000 children in California. This modest investment in health care will be transformational in the lives of families and kids and will save dollars we are currently spending to provide limited care in overcrowded emergency rooms. SB4 includes important reforms to implement the Health for All Kids program. The bill clarifies that kids currently enrolled in restricted scope emergency Medi-Cal will not be required to submit a new application when they transition to full scope coverage. It ensures that kids currently enrolled in restricted scope emergency Medi-Cal will be transferred to full scope services immediately as soon as the program is operational on May 1st, 2016. And it ensures that kids with serious medical conditions that require specialist care who are being newly enrolled in the program will be properly evaluated and referred. Ensuring that every kid in California grows up healthy with an opportunity to thrive and succeed is the right thing to do. I respectfully ask for your aye vote, members.
Thank you, Mr. Bonta. Mr. Chavez, you are recognized.
Members, I stand in support of this bill, and I want to explain it. Not so much to all of you, but I can actually tell you the hundreds, if not thousands, of people who've been calling my office over the past 48 hours since I supported this in the health care bill. Originally, when this came forward, I did not support it because I felt that the Affordable Care Act in covered California had a long way to go until we added more people into the system. And I still believe that. But there have been changes in this bill, and this, as you know, the governor has put it in his budget. This deals strictly with children. And as I reflect on it, I think in the state of California, we educate all children. We don't really care where they are because we know these children are here at no choice of their own. And it's important to invest in them, not just for their future, but for the future of our state. I ask you, members, why would we invest in their education but not invest in their health so that they can take full advantage of that education. It's for that reason that I'll be voting for this. So all those people who are wondering why did I change my vote, that's why I changed my vote. When it gets down to the issue, a lot of us were looking at that young child coming across from Syria who drowned in the Mediterranean. You know, sometimes what we have to do as a society is take care of those who need being taken care of. And if you have a question where I'm at, I'll always stand with the children. I ask for an aye vote.
Thank you, Mr. Chavez. Mr. Alejo, you are recognized.
Nice try, guys. Mr. Speaker and members, as the chair of the Latino Legislative Caucus, I rise in support of SB4, a Latino Caucus priority bill. This bill will focus on ensuring the successful implementation of the Health for All Kids budget action. For the first time, California will provide full-scope Medi-Cal coverage to all kids starting in May 2016, regardless of their immigration status. It is expected that SB4 will provide health care coverage for 170,000 California kids with negligible cost associated with the transition of children to full-scope Medi-Cal. This bill will be a major accomplishment for the immigrant community and will symbolize the values and willingness of our state to protect all our kids. SB4 will be a down payment on achieving true health care for all. I respectfully ask for an aye vote on this bill.
Ms. Melendez. Ms. Melendez, you are recognized from your desk.
Thank you, Mr. Speaker. I think we all have compassion in our hearts for the kids who are here, who are struggling, whether they're here legally or illegally. The question, though, is this a budget priority for us that is appropriate? We had a committee hearing today where we were contemplating how to pay for the developmentally disabled community and their needs, which they have been asking for years and years. The answer to paying for those needs was to levy a tax on a product that's sold in California. Now, we had an opportunity when we were going through the budget process to allocate money for that community, yet we did not. But we have this bill which seeks to expand a program when we can't even pay for the programs we have in place. The developmentally disabled community is already an established program. They need their funding so that they can stay afloat. We didn't give it to them, but here we are contemplating expanding a program that we can't agree on. This is completely inappropriate. I urge a no vote.
Thank you, Ms. Melendez. Mr. Thurman.
Thank you, Mr. Speaker and members. I rise in support of SB4. We have had considerable conversation about this bill in our subcommittee on Health and Human Services, and we've discussed the benefit that would be for these young people and to the communities where they reside. I would ask you to consider doing the right thing for young people who need to have health benefits. If you can't look at it from that standpoint, consider it from the financial standpoint, that SB4 would expand prevention programs that would ensure that young people have preventative health care. We all know preventative health care costs less than emergency health care. This is an investment in young people. This is also an investment that helps us to reduce the cost of overall health care in our community, and I strongly urge your aye vote for SB4.
Thank you, Mr. Bonta. With that, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll. Tally the vote. Ayes 51, noes 23. Measure passes.